Thank you very much for the invitation to present today. I really appreciate the efforts by Biosample Hemp to create and rejuvenate this dialogue about being able to utilize samples from various parts of the world. So today the focus would be on the utilization of biospecimens from sub-Saharan Africa. I'm Zisis Kozlakidis, the head of laboratory services and biobanking at the International Agency for Research on Cancer. And to provide a little bit of a background, it's just one slide. We're an executive agency of the World Health Organization created in 1965, and we perform cancer research for cancer prevention, but our focus is really international. And it has to be interdisciplinary, has to be inclusive of low middle income countries, and a lot of what we do intends to inform public health decisions, policies, guidelines, and standards. So today I'm going to talk a little bit about the background and the trends that we see, the issues or challenges with the sample and data quality and use and the current activities in low middle income countries that we have and how we see things develop in the future. And also, as part of the discussion, we are going to have some questions asked during the presentation, which I hope will fuel further discussion later on. So, in terms of biobanking and all the samples that we have available, the reason why biobanking has come to the fore, at least in my opinion, is because it's foundational in supporting this precision medicine vision, moving from this empirical medicine treatment approach to a more personalized medicine approach. And we can argue how far down the personalized medicine pathway we've come. But that's the main driver. And in terms of the market size, we can see a very steady increase of about 7% year on year as an aggregate growth rate, which means that there is a very steady increase over a large period of time. And this has been maintained at least over the last 10 years. So biobanking is not, it's not just that there are more biobanks being made, but the ones that already exist are becoming larger as well. And that's reflected in the aggregate growth. But it's not only about creating more facilities. The user demands of each one of these facilities have also expanded. So whereas before biobanking was a very basic collection and storage facility, now biobankers are very actively involved into the patient management and the consenting process, the data handling, the virtual catalogs, the link of the data with electronic laboratory notebooks, and the distribution of samples. So the range of activities, the scope of biobanking has expanded. And that's true both for population and disease-specific biobanks. If we are to summarize this development over the last 20 years, we can say that originally biobanking was focused on the number of specimens because all these omics technologies were coming online. So do we have the infrastructure to keep feeding the rate of samples required by the new omics technologies? When that was satisfied and we knew we could do it, then very quickly the discussion moved on to the quality, because we have this tenet, which is very much true, of if we put rubbish in, we get rubbish out. So the quality is of paramount importance. And now we are moving into a next stage, which is a lot more mature for the field, about the value of these collected samples and the impact that biobanking has altogether in terms of research and technology. But when it comes to sub-Saharan Africa, the picture is not as clear, because this might provide the false impression that we know exactly what is happening in the direction of travel. Perhaps yes, at the 30,000 feet view, but we need to be a lot more granular. So when we're looking at sub-Saharan Africa pre-pandemic, we've had the understanding of needs for infrastructures, and that came through a number of publications. This is just one example about the priorities for cancer research. And it had a list of 10 priorities. Now, if you look back in time, these priorities haven't changed much. And one of the reasons is that they don't have sufficient granularity to be addressed. They talk about awareness, funding, access to basic facilities, and so on. But this is very generic. So this year, earlier in the year, in the presence of the Rwandan Minister of Health, we've unveiled the Cancer in Sub-Saharan Africa Lancet Oncology Commission, which provides a bit more granularity. So when we talk about leadership, for example, what does it mean? It means that we need to have dedicated leadership training in Sub-Saharan Africa, because leadership is context-driven. When it comes to research and research ethics, we need to have better data governance policies. And I'll come into that. So we have progress in getting some of the granularity that comes to biological samples and data. And we've tried to push the envelope a little bit further. We focused on the infectious diseases this time and the biobanks of infectious diseases, and break it down a little bit more. So when we talk about limb systems, for example, what are the challenges? The challenges is that we have many legacy systems from different initiatives that have to coexist. So how do you enable this to happen? By having some open access solutions and some data quality indicators, so that you can keep utilizing what has happened already as part of novel applications or research activities. But also, we're trying to find out what type of samples we're talking about. If we look at Sub-Saharan Africa, most of the samples that have been collected are blood-derived products at -80, FFPE slides at room temperature, and DNA or RNA samples at -20 or -80. So it's good to have the granularity, but also we need to be able to adapt it to the types of samples that dominate that particular region. So when we talk about quality indicators, then prioritize those relating to blood products at -80, as opposed to liquid nitrogen, for example. And then the question is, what is the information that we have about the type of data? And the answer is, we have a series of anecdotal accounts that relate to particular institutes across the continent, but we don't have systematic reviews. And it's the same for the data quality. So we have anecdotal accounts for individuals, for individual institutions, because there are many centers of excellence and they do fantastic work, but there isn't a systematic review that will allow us to understand over a series of 5-6 nations what the level of data quality. And why do we insist on the data quality? Because the quality in biobanking really is the key to the future. And as the future will be data-based and data-driven, we expect to see families of standards around laboratory data emerging, and they will complement existing ones. So we don't expect that the ISO 23887 for biobanking will be replaced. No, it will be the umbrella standard underneath which further standards for data quality, for example, may be housed. So what have we done? That's fantastic. I can sit from Lyon and say this is what needs to happen in Africa. Excellent. But actually, what have we done to promote this movement in the right way? In 2017, IARC published the Common Minimum Technical Standards and Protocols for biobanks dedicated to cancer research. And this is the lowest common denominator for biobanks collecting samples for cancer research. And we've run a number of workshops trying to train a lot of our collaborators in sub-Saharan Africa for the standards that are required based on the new technologies that have come into research. ISBE published the best practices, and then, as I said, the ISO standard came online. And following this, you can see some qualification programs that are starting to emerge. So we started having the BBMRI ERIC Academy, the qualifications from ISBE, and this is good because not only do we now have the lowest common denominator, we have the ISO standard, which is the highest attainment, and the best practices that guide you as a pathway how to get there. Also, we have the qualification program that will tell you how far on this pathway you are. And honestly, not all biobanks might want to go for ISO accreditation, but at least they might want to attain some other qualifications, be it national or international. And they are now having the tools to be able to see how far they are along this pathway. For us, importantly, there are also courses now emerging in Africa about biobanks. For example, this is the master's course at the University of Alexandria in biobanking that has started this year with the first intake of students. So it's not that we have the standards, but we start training individuals from Africa, in Africa, for African needs. Now, you will see that this discussion is a little bit tilted on the data side as opposed to the physical sample side. And one of the reasons is that we see that the COVID impact that has come with regards to data. So if we see the number of digital device interactions per capita per day in healthcare, you can see there is a logarithmic growth. What has happened is COVID has accelerated this growth even further. So whereas the estimate stood at about 5,000 interactions, it has quadrupled during the pandemic. It might come down, but not back to the 5,000 estimate. It will remain quite high. So the anticipation is that the biobanks would need to reflect, or let's say that this trend on the data would need to be reflected on the operations of the biobanks. So do we have any regulations or guidance in terms of the data? And the answer is yes, it's getting there. In 2020, there was the Riyadh Global Digital Health Summit, where a number of recommendations were outlined in terms of digital health. And there were 9 recommendations, again, very high level, but very useful because it's the first time that was top of the agenda. This year, with the G20 meeting in Indonesia, we've started breaking them down a little bit further. So what do we mean when we talk about transparency and trust in digital health and the data? We mean that the information will be provided in a timely fashion. And that's across the healthcare spectrum, including biobanks. So we start seeing some granularity. Of course, we have to continue this process and try to understand, in the same way that I presented about infrastructure earlier, how do we move this about data in sub-Saharan Africa? So IARC is putting a lot of effort through BCNet. The Biobanking and Population Cohort Network, that's the acronym for BCNet, it was created in 2013, and it's a research-ready infrastructure network within low middle-income countries. You can see the distribution of countries that we have in the network. We provide the harmonization of processes and training in biobanking standards and SOPs, and ongoing support through the online educational portal. It's very, very generously supported by the NIH, the NCI, and I would like to thank very much Marianne Henderson for the support on that front. So what does a research-ready network mean for biobanking? It means that when we have a big event, we can collect the information, publish it, and disseminate it very quickly. And COVID is one such example, in one such case point. So, for example, COVID came, we very quickly wanted to see what is the impact of COVID on biobanks across the world. We mobilized through BCNet, through ISBE, we've created a special issue which has been made open access through a grant by the NCI. But again, we come back to the same question. We talk about data and making this available. How realistic is this expectation? And what we can say is through our own work is that while the need to share data and samples is evident and it's supported in principle, the implementation does vary widely. And this is especially true in low and middle income countries and BCNet member countries, where we have laws and soft laws, which is professional guidelines, say from the medical establishment, that coexist. What we have seen over the last 10 years, it's a fantastic development. So this is a very positive development for regulatory frameworks being developed in LMICs. So that's excellent. And I've provided the links for all these references through the slides. And I'm happy for the slides to be shared after the presentation if anyone requires. So what we see, for example, is this development of frameworks, but while it is positive at the same time, it's problematic in terms of the regional compatibility. Why do we say this? Because if you look at the map of sub-Saharan Africa, and you look at the data protection laws that directly affect biobanks, you can see that we have legislation recognized by the European Union as equivalent, legislation that is there, but it's not recognized as equivalent, and areas where there isn't any particular legislation on data for biological samples. If we look even from a different perspective, we have a linguistic legacy issue because we might use the same terms, but we understand them in a different way based on our linguistic heritage. And that's very pronounced in sub-Saharan Africa, where you have the Anglophone and the Francophone. So we do have challenges. How do we overcome them? We need to be having the discussion. We need to have this increased visibility and always being inclusive of our sub-Saharan African colleagues. And this is one of the sessions we've organized at the UN General Assembly Science Summit, where the International Cancer Institute from Kenya, from Eldoret, was able to present a lot of these challenges on how they are able to collect the data and samples, but they don't want to simply provide them to some outside source. They need to be equal participants to the work that's happening. I'm going to say that a lot of this experience is being distilled into training courses. We've launched the Global Laboratory Leadership Program 2 years ago, rejuvenated and updated. We're working with the WHO Academy for a new course on managing healthcare research infrastructure. And of course, there is a dedicated portal at the IARC Learning for Biobanking, and that is free to access through the IARC Learning portal. What do we anticipate in the future? We certainly anticipate increased complexity. The ability of data to be used again and again and again, as opposed to the physical samples that at some point will be exhausted, means that the there will be an increased probability that the data will be mixed and used different ways. So the complexity will go up. And also we expect an increased focus on ethics. The advancement of the technology and the ability to do things doesn't necessarily mean that we should go ahead and do them. Perhaps first we need to anticipate some of the ethical challenges before launching straight ahead. And I'm really talking about the misrepresentation of population groups and the misuse of samples and data. I would stop at that and would be more than happy to take any questions. Thank you.
Thank you so much, Dr. Zisis. I think this was an incredible presentation, and I think the audience would learn a lot from this presentation and how you started from the access of samples in the low and middle income countries, and what are the challenges faced in accessing those samples in sub-Saharan Africa, and what are the parameters that we need to look at while considering, going to sub-Saharan Africa and requesting those samples. And you mentioned some of those as well, like leadership training and harmonization of the processes between the country, and also why quality is so important. I just have a very small question in the beginning. I think it could be really big as well. The thing is, how long do you think would take to actually, achieve those standards of biobanking, or achieve those good practices for smooth access of samples from sub-Saharan Africa to the rest of the world?
That's a bit of a big question. So I think, I'll respond as follows. We already have centers of excellence that work with very high levels of quality and expertise. I think the challenge is, how do we link or connect the dots so that we create critical mass? And once we do this, I think that's where you will start seeing others following the examples and the field altogether moving upwards. And being able to harmonize at least some of the processes allows these dots to be connected on the practical level. Of course, there is the leadership and the political will, which is very much situational. It's context driven, it's financially driven. But at least on the operational perspective, being able to harmonize will allow us to do so.
Yeah. Oh, thank you. Thank you so much. I know it was a vague question, but just to see how much time do we have to be able to, achieve those good standards. And the next question would be, you mentioned some of the programs that were being initiated to improve the harmonization and also help, introducing and developing those workshops to train the leaders. What factors or what parameters do you measure the improvement? And have you seen any improvement after, introducing those kind of programs since 2017? Say.
I think the pandemic has been a very interesting diversion from the course. Very interestingly, a lot of the facilities and the staff that has been trained were immediately placed on the response to the pandemic because they were ready and of a very high caliber. So I would say indirectly, yes, but perhaps not for what we were originally intending. I think what will accelerate a lot the development is the fact that we now have a long-term commitment by educational institutions in Africa, so in Morocco, in Egypt, to train students in biobanks at the master's level.
Yeah.
And this is fantastic because a limiting factor always has been the finances. How can all these colleagues that are doing fantastic work get all the money to come to Europe to study for biobanking? It's just an expense that many cannot afford.
Yeah.
Bringing it closer to the financial ability, to the cost, will accelerate the number of professionals that are properly trained, and that will reflect very quickly on the quality of samples and biobanks that we have.
Yeah, I think this is a really important aspect that you mentioned. There are not many institutions that offer biobanking courses in Africa, and most of them are based in Europe. And I think for the rest of the world as well, there are not many biobanking courses being offered at many of the universities. And they just fail to see how important it has become now and will also be in the future as the complexity arises. I think we will need more biobanking professionals with that kind of expertise. And I think I would just end with one last question, and then we can ask Robert as well if he had any questions. As what advice would you give to researchers from outside Saharan Africa or from high income countries to access samples from this specific region, and where should they start actually? Because I think a lot of researchers come and they say we don't know where to start as well. So what advice would you have for those people?
Yes, and I do understand this perspective, this viewpoint, because the way that Africa is a very big place and it's very fragmented. And it's fragmented in terms of customs arrangements, custom compatibility, the legal compatibility, the linguistic compatibility. If you overlay all these compatibilities, then you understand why every initiative recreates the wheel, because there isn't a particular pattern. And that also confuses a lot of the researchers, because they say, well, what do I start? I see everybody's doing something different. And I think the easiest would be to see whether some of the existing programs or surveillance mechanisms or registries can accommodate research questions that we want to ask, and then build on this existing collaboration. I would advocate always to try and do as much of the research as possible in Africa with the African colleagues. They're not simply the providers of samples, because then we just create a one direction relationship, which is very fragile when conditions change.